My name is Dr. Aseem Malhotra. I'm a consultant cardiologist, and my mission is to save lives a million at a time. I think the main focus on what people eat is really going to be the solution to dealing with many of the chronic illnesses that we deal with today. And I say this as someone who's been a practicing doctor in the NHS for almost 2 decades, as a consultant cardiologist with all my knowledge and experience. You know, the mantra is true, food is medicine. If we're going to fix our healthcare system, we need to fix the food. And that means having an understanding of the very basics of nutrition. Training in nutrition is so important in today's society because one of the first questions I ask my patients when they come in is, what are you eating? And often many of their problems are related to the types of foods, the modern ultra-processed food environment driving the consumption of these so-called, what I would describe as fake foods, essentially, that don't nourish you, that are going to increase your appetite, that are going to contribute to you putting on weight and excess body fat and causing inflammation in the body. So for me, many of these conditions, chronic conditions, whether it's heart disease or type 2 diabetes or high blood pressure, are very much rooted in what we eat. And therefore the solution is going to be fixing the food. In terms of what message I would give out to people who are thinking about retraining and focusing on nutritional therapy, I think absolutely follow your passion, go for it. It's a really important area. I think being empowered with those skills, as in particular, the practical aspects of being able to help people change their diet for the better, I think can be very rewarding and very powerful to help many, many patients.